It's a pleasure today to speak with you about the future of healthcare and a paper that we have in the Mayo Clinic Proceedings that will come out in the July issue that summarizes some of the efforts that we as a Department of Medicine in Rochester at Mayo Clinic are pursuing to transform healthcare. My name is Vijay Shah. I'm the Carol M. Gatton Chairman of Medicine in Rochester, Minnesota.
I'm Natalie Kane. I'm the Associate Administrator of the Department of Medicine at Mayo Clinic in Rochester.
So as a start, we're going to review one of the figures from the paper that summarizes the pillars that we're utilizing to drive our strategy for medical transformation with a vision of preventing and curing medical disease worldwide. The first pillar relates to practice innovation, and this is really all about digital transformation. How do we bring new processes into our care models that include digitization of data, automation of our processes, and then introduction of smart processes or AI into our work streams? And we're very hopeful that the technologies that we introduce will be of value for our patients and also equally important of value for our providers as well, given the epidemic of burnout that's occurring in the current models. I'm going to turn the second pillar to Natalie Kane.
So business development, really our goal with that is to advance novel solutions to improve the well-being of our patients with serious and complex disease. And in order for us to do that, we need to leverage our knowledge and envision solutions to patients that may not have the opportunity to come to Mayo Clinic, but can benefit from our knowledge and expertise at a scale that can reach patients wherever they might be. In order for us to accomplish that goal, we work with a variety of partners, some of which are very close with Mayo Clinic, some which are new and are finding new solutions that we can partner and bring our knowledge and expertise in order for us to really meet patients where they are across their journey and their continuum. So we're really excited about how we can take such knowledge and expertise that we've developed here, partner with the right partners that are also aligned with our values and expertise to really help reach patients in underserved areas and areas where patients might have not had the opportunity to travel to Mayo Clinic, but also leveraging these experiences and opportunities for our patients as well, if they're at a destination site virtually or seeing one of our partners. All right, BJ, back to you.
So thanks, Natalie. So we'll talk about our third pillar, which is around cures. And cures has tremendous opportunities for the future, given the revolutionary changes that are occurring now in genetics, high throughput computational biology, the ability to store data and analyze data, bioinformatics, as well as gene therapy and other molecular and immunologic technologies. And so cures will really allow us to start to look at a number of new ways that we can help our patients. This includes new CAR T and immunotherapy platforms, as well as new molecular therapies that are even delivered through an endoscope, which we refer to as an immunoendoscopy platform. So those are a couple of the examples that we have under cures and many more to come. Back to you, Natalie.
Happy to talk about culture and people as really the foundation of what we do. We really have such amazing colleagues here at Mayo Clinic and really are committed to having a diverse, agile workforce that is grounded in our values around compassion, meaning, and purpose in our work. And so supporting these values really gives us an opportunity to invest in our colleagues, support the interests that they have to continue to expand our reach, develop new skills, evolve to meet the patients and the needs that they have, while we really entertain bringing an inclusion environment that supports diversity in our thought, interests, and all types of backgrounds, so that we continue to support the needs of our patients while supporting our teams and our colleagues as we do that.
Thank you, Natalie. So that was the summary of the four pillars that make up our strategy for healthcare transformation through the Department of Medicine. I'll just take a moment now as we reach the tail end of the podcast to provide you a vignette of what care might look like in 2030. So this pulls in some different concepts that we've been working on, including the 24/7 digital clinic. And really what that is all about is the ability to monitor patients, collect data that informs treatment for those patients real time, all the time. And you can imagine that that will involve a number of smart processes that we're well on our way working on. And when the patient does need to come in, and when we need to see them to provide serious and complex support, we will have a variety of approaches that include multiple data streams that inform personalized therapies for each of the patients through a project now that we're pursuing that's referred to as the digital twin. So furthermore, if the patient needs to be hospitalized, we're looking at seamless transitions between the outpatient and home, as well as in the hospital, which we refer to as blurring the boundaries of care. So we have a lot of excitement for the future of healthcare and our ability to bring a number of new and important changes into the healthcare system. And they're summarized in this paper. So again, we recommend you have a look at the paper. And with that, thank you so much for listening, and have a great day.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.